Okay, thank you. Good afternoon, and this is our Monday report with Dr. Yaffe and myself after seeing what happened over the weekend. And as you've heard today, one of the announcements was the movement to stage 3 for 24 of our regions in Ontario, and that would be entering that on Friday. And we had lots of discussion with the medical officers of health, both the ones that are opening and the ones that are not yet opening. And there was a general agreement on the process going forward at this stage, noting that what we've been seeking to have is 4 weeks of data. That means 2 incubation periods, while on a cautionary basis, an important one, as we've seen some places, especially in the United States, where they have opened too quickly and have had now to backtrack on some of those, and that is certainly perplexing both to the commercial side but also to the public, and so we do not want to repeat or have anything like that. We have been moving steadily in a good direction. The metrics for all those 24 were excellent, and we have are moving forward with confidence to ask them to allow them to do that as of Friday. But by we're going that way, it means that some of the others will need another week of data, and we'll be looking at those in a timely fashion. We're hoping that if everything goes well with all the areas, we'd like to have everybody, if possible, at stage 3 by the end of July. Just because we're going to stage 3 doesn't mean we have to let our guard down. We have been doing this all along in the staging because while we are opening up some things, we're still asking the public to be diligent in their adhering to all our aspects with the 2 meters, the facial covering in indoor spaces or where you cannot maintain your distancing, washing your hands frequently with soap and water or alcoholic hand rub, and also covering up with sneeze or cough, and of course staying home if you're ill, and reporting or getting assessed if you think you have signs or symptoms or in a close contact with a person with COVID-19. So we're opening up now to stage 3, and more things opening up, more things out in the public setting. Still, more need to be adhering to those things we've asked for. So some things are opening, some things remain the same in that, but more and more industry and businesses are opening up with only a few remaining, and we have some limitations on those. And we're still in the process of reviewing some of those organizations' plans of how they might be able to open up in the near future, but still maintaining these type of public health measures, which so far have been quite effective at bringing our numbers, which you're going to hear in a moment from Dr. Yaffe as she reviews the numbers. So with that, I'm going to hand things over to Dr. Yaffe to talk about today's numbers and some aspects of what we did over the weekend.
Thank you, Dr. Williams. So after a slight increase in the number of new cases last Thursday, which was attributed to the testing of temporary farm laborers in Windsor, Essex, Ontario's case counts continue to follow a decreasing trend. Over the weekend, Ontario reported just 130 new cases on Saturday, 129 cases yesterday on Sunday, and today, 116 new cases, bringing our total to 36,839. As the Premier noted earlier today, 29 of our public health units are reporting 5 or fewer cases, and 21 of those health units have reported no new cases at all. The new cases we're seeing are concentrated in Toronto, Peel, York, Windsor, Essex, and Ottawa. We also remain encouraged by the low number of deaths being reported. In the last week, Ontario recorded a total of 33 deaths, with only 3 reported today. The number of patients receiving care in hospitals has also been dropping steadily, as have patients in ICU and on ventilators. While we continue to work at managing outbreaks occurring in our long-term care and other settings, in agri-food sector, we have seen a declining trend in the number of outbreaks in our long-term care homes. Currently, there are 25 outbreaks in our long-term care homes and only 76 active cases in residents and 148 in staff. With respect to testing, we continue to see a high number of tests processed every day. While the number of tests remains high, the positivity rate has remained below 1% for the last week, and in the last few days it's been around 0.7 to 0.8%. As we move into stage 3, these numbers and trends are very encouraging. It was only a month ago when Ontario was still recording well over 200 cases a day. To echo the minister's comments from this afternoon, it is because Ontarians have been following public health advice that we are able to cautiously move forward. We want to sincerely thank you for your continued vigilance and collective efforts to protect yourselves and your loved ones from COVID-19. I'm going to now turn it back to Dr. Williams.
And with that, we're going to open up for questions from the media. So we're open for questions. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question.
And if you do ask a question, you will need to press star 1. And your first question will be from Scott Lightfoot at CTV News. Please go ahead.
Hi, Dr. Williams. Wondering if you could speak to the businesses and industries that are considered high risk and will not be allowed to reopen in stage 3. Can you give some sort of examples as to why these are specifically high risk? What makes them unable to open at this time?
So in stage 3, we have moved the public gathering one from the previous number to now 50 indoor and 100 outdoor. That is certainly some more than some provinces who have lower numbers than ours have done. But we feel that the way that public have been handling their limitations and adhering to the public health measures has been excellent. So we're going to look at that. But some of the ones that are not being allowed to open are the ones that have even larger gathering numbers that are necessary to carry out their functions. For example, large multi-theater movie theaters. How would you do that? Large convention centers, amusement parks, water parks, where normally you're dealing with numbers of anywhere from 5 to up to 800 or 1,000 people at a time. And some need those kind of numbers in order to be economically viable. So we haven't yet moved to that, like a large outdoor concerts and things like that. But we are looking at some of those other ones that are planning to give us business plans, how they might be able to accommodate that with special restrictions and activities that would keep up the standards of the distancing, the other aspects of avoiding large crowd gatherings, and to maintain those public health functions. So those are examples of a few in that, in what you asked in that context.
And for a follow-up then, just wondering, I think you sort of mentioned it, but they're laid out by industry, for example, amusement parks, movie theaters, that kind of thing. But would an individual operation be able to come up with a business plan which would allow you to give them the go-ahead to open? So it's not just a blanket order for all amusement parks, but if one could show that it can adhere to the guidelines in place, that it would be acceptable to open? Is that sort of how this will work going forward?
Yes, and that's what that open line is, and where they can submit them to the ministry, to the government, and the government look at those, and then issues related to public health could be looked at by our public health measures table to give the broad general overview. So it's like a two-step process. So yes, they are open to seeing what plans some of those industries and locations would like to put forward as a plan that they might be able to open up, and at the same time maintain the proper protections as we continue through stage 3 in our attempt to make sure we avoid, if we can, or flatten down a second wave.
Next question.
Will be from Michelle McQuigg at the Canadian Press. Please go ahead.
Hi, Dr. Williams and Dr. Yaffe. A quick question and also a quick clarification. You mentioned that there were cases in Ottawa, and I wanted to quickly confirm with you that Ottawa is still permitted to move to stage 3 in spite of that. But my real question has to do with the shift in numbers. You alluded to this earlier, Dr. Williams, when you said that the numbers now allowed in indoor and outdoor gatherings are in fact higher than some provinces with lower caseloads than Ontario's. Could you share a bit of the rationale behind the decision to make such an abrupt move from 10 to 50 or 100 respectively?
So we had looked at this in the past, and a number of other places who have even more cases than us, they even have larger public gatherings. So we're not at the low end or the high end. And it tells you each province is looking at it from different perspectives and what they would like to have as cautionary, or they see with more assertive opening up at different stages. We felt that the 50 indoor and the 100 outdoor was a reasonable way to go with our information on outdoor gatherings, people keeping the 6-foot distancing, having tables set apart or different aspects there. The 50 indoor, to say if you're going to do that, how would you space people in that? So we've been a lot more strong on our recommendations around the ongoing spacing, masking when necessary, and to maintain crowd control and flow in that, especially in areas of so-called pinch points or crowded things such as certain sales venues or restroom facilities, and how they might want to handle that. So we think with the different things that have been brought forward, it seems to be a reasonable one. That's what stage 3 is about. We'll go with the first 24. Let's see how that goes. Let's see if we have some problems or issues in that. Let's see if we have to tighten up a bit more around guidance and direction around that. Much like we did with stage 2, as you know, we ran into an outbreak with a industry. One was a nail salon, and that was handled, and that advised the rest of the province. We had to be a bit more, I would say, vigilant on handling those and recommendations and guidance around that. So that's one of the aspects. We go in stages, we look at the data, and do we see if in sometimes open it up, is it too much? Do we have to put some extra guidance in to deal with some shifts in numbers? So that's part of the idea of going with the first 24 that have very low numbers. If there's no issues with that, we can go to the next group and the next group, and then we see over a period, is everything going well, and is there any problem with going to 50 to 100? So that's the logic behind the staging and taking time through these incubation periods to watch to see if anything arises in the ramping back up to the recovery phase after phase 2.
Follow-up?
Thank you. Yes, the follow-up is actually on behalf of my colleagues in our sports department. With Toronto designated as an NHL Hub City, I'm sure you're aware that there's going to be considerable additional testing done for those players and everyone in their immediate orbit. I'm wondering if that's expected to present any kind of additional stress on our testing capacity, or do you think we're well equipped to handle that influx?
We've had discussions with the NHL on their testing. They can go through private sources to get it done. We just want to make sure that it is of quality and can be covered that way, so that if there was any concerns, that Toronto Public Health or the province could be informed of any issues. With that, we're looking at the volume of the testing, how much per day, with their players being tested. More at the beginning, I guess, as teams get eliminated in their playoff venue, they'd have less and less testing. So right now we feel we can handle that capacity, but we will continue to monitor that and to be in discussion and dialogue, as we will be with the NHL, with Toronto Public Health throughout this process.
Next question.
Thank you. Next question will be from John McGrath at TVO. Please go ahead.
Good afternoon, doctors. I've been following the, I guess, controversy over aerosol versus droplet spread and this debate that's happening with like the World Health Organization and others. And I'm wondering, is there a way that this would affect the public health guidance that goes out to the public, whether that would be either masking rules or businesses that might need to be closed? How would this controversy over aerosol versus droplet spread act? What would that mean to people in the real world?
Yeah, thank you for that question. I think there has been a lot of media around that report from the WHO, and of course, we are dealing with a new virus, a new infection, and a lot of information continuing to emerge as we learn more. I think the bottom line is that our real-life evidence has shown that this is almost virtually entirely transmitted through large droplets. If it were aerosolized, we would be having widespread outbreaks, way more than we've had. However, what it does show is there's the theoretical possibility for very small particles to remain in the air for a while. And that is a big issue for medical procedures that generate aerosols. For example, when you're inserting a tube to ventilate a patient, or you're suctioning a patient, the aerosol generating procedures, that's when the staff who are doing the procedure need to wear an N95 mask. It's also telling us that it's important to have good ventilation, particularly if you're in a small a crowded space, you should be wearing a face covering, but you should also try and have good ventilation, open the window or increase the air conditioning. But as I say, in real life, it's not something that's going to have a major impact on the procedures or the protective policies that we are recommending, but we continue to monitor the science and evaluate what needs to be done.
Follow-up?
On a slightly different topic, there have been a number of jurisdictions that have reopened bars and restaurants to find that their numbers go out of control. Obviously, Ontario is moving forward with reopening bars and restaurants, and I'm wondering what is distinct about our situation so far that clearly must be giving you some confidence that we aren't just going to repeat other people's errors.
So as you know, in stage 2, we allowed restaurants and other ones to have patio outdoor seating. At first, we saw some people felt some overcrowding of those. They seemed to settle down into doing it properly. We didn't get any, as compared to some other jurisdictions, outbreaks reported in consideration of those settings. As we now go into allow indoor, we put some stipulations around the bar activity with the singing and the crowding and that. We still require the distancing, and as well as the restaurants that can they maintain the 6-foot seating distance between patrons or social groups, circles at each table, and still have the protection of the workers. So all those things have to be in place, and we will continue to monitor that. I think some who maybe had difficulty keeping those things in place had to retract and pull back on that to some extent. So we're hoping we don't have to do that, because I think the regular patrons of these facilities would like to have them available on a regular basis, and I think they would want everybody to follow the rules accordingly so that they can enjoy those facilities as well as the business being given to the organizations, and it's like a team approach. So we want the retailers to manage it properly, and we want the customers also to respect that and respect each other so that we can move steadfastly towards recovery phase. And as always, I think in Ontario, as we do it right, we continue to do it right because we have that aspect of mutual respect for each other in that regard.
Next question.
Next question is from Katrina Clark, the Hamilton Spectator. Please go ahead.
Hi there. Thanks for taking my call. My question, it's regarding an update that Hamilton Public Health provided on Friday, and it was on the delays residents here are seeing when they're waiting for negative COVID test results. Some people are waiting 12 days or more. And Public Health has pointed to issues potentially with the provincial portal through which people access results. They're saying that's where the delays might be happening. I'm wondering if your office is aware of issues with the portal.
Yes, we are aware of those issues, and certainly I've had communication with the medical officer of health from Hamilton, and several people have communicated with us. So we have been communicating the issues with the public health lab, the people who are running the lab network, and the Ontario Lab Information System. And I know that they are fully aware of the issues and working very hard to fix them. It is frustrating, and I know everybody's working as hard as they can to solve the issues as quickly as possible.
Follow-up?
Thank you. And then relating to the new Stage 3 rules and what people can expect if they are exposed to the virus, say someone's eating inside a restaurant and someone there has tested positive for COVID. Do they later have to self-isolate and monitor for 14 days? And would they say if they were on a patio?
So that's a good question, because when we're asking the retailer, if you're talking about, let's take an indoor restaurant facility, we want them to keep a log of who has been in the place. So if there was a case reported in that, someone called back and said, Public Health said, there's a person reported on Wednesday night, whatever, at your place that they were there between 8 and 9:30. They would look at their log and say, okay, they sat at table 14, and around that were the following ones. And so they can give those names actually to Public Health, who could contact those people as being no, if it was 6 foot distance kept, we'd say, well, it's not a big deal. Who else is at the table with that person? That's the more important one. And they would be then contacts of a case. They would then have to go into isolation while they get tested by Toronto or by health, public health, not saying Toronto, anywhere, when they open up. And they would be tested just like we do with all the rest. So, but if someone says, well, I think I was in contact with a case, but I sat at the table with 3 other people, then while they're saying, well, that they're going to do self-monitoring, well, that person who is the contact with the case has to wait until their test results back. So you can see how the case contact management is handled, and the fact we can circumscribe rather than saying all, say over the period of 8 hours the restaurant is open, everybody has to be monitored and tested. That's not really necessary if all the rest did the 6 foot distancing. We just have to look at what is the case contact management that's needed at that time. We can move at it much more expeditiously, much more efficiently, and with proper education information to the patrons at that time. So that's the thinking around this gradual opening up and people being consistent in that. And it saves public health and the public from a lot of false alarms when it's not really necessary, when the proper steps and procedures were followed throughout this process.
Next question, and this will be the last question.
Last question will be from Heather Wright at the Independent Petrolia. Please go ahead.
Thank you. Good afternoon. I wondered what science public health is using to keep families out of nursing homes. There's only 76 cases in residents and 100 some odd in home care workers. And are you aiming for 0 or what's the plan?
So the visitor policy for long-term care is currently under review and is expected to change shortly, I believe. We give input from a health point of view. The decision is made by the Ministry of Long-Term Care and takes into account science and other factors, obviously. But we do have the opportunity to give input into the policy.
Follow-up? Follow-up. This will be the last question.
I'm sorry. So then does public health believe that there is, it would be okay for essential caregivers to return then?
So I think we're trying to work with the Ministry of Long-Term Care, who are still working with their IMS group. While the numbers are coming down, and thank you for pointing that out, it was a bit surprising to me today that we had a steady drop in the number of outbreaks. We had an increase since yesterday of 2 new outbreaks. Hopefully those are false alarms. I'd like to hope that. We still have some healthcare workers being reported positive from place to place. So it's not that we're out of that totally. And don't forget about all the challenges we went through and the deaths and lives lost in that. And so it may be that people really want to get out. And we know that, and the long-term care ministry knows that, as relatives and friends want to get in to help out and to be accessible, they're gradually changing their guidelines and opening up more and more to visitation. And it would be great if we can get that outbreak number down to nearly 0 if we could, and those other cases resolved and open up. Part of that is I think in the stage 3 thinking, as you have these areas that have evidence and ongoing proof of very little community transmission, it gives much more reassurance that public coming from those communities or staff coming from those communities are less likely to be carrying the virus back into the long-term care facilities, and that helps to drive some of the overall addressing. So in a way, how well we do stage 3, it gives us much more latitude with other things that we have coming down the path. So stage 3 is just another movement towards opening up wider things, not just retailers and business, but how do we handle, even with the public gathering size. It doesn't mean that in the next number of weeks everybody goes to stage 3. We would hold it there. We might say it's doing so well, can we increase it again if the metrics look good? And so it is an ongoing monitoring process, and to see how well we can handle stage 3, that might even impact with visitation too, and give reassurances to the long-term care ministry that the happenstance or the case of another infection being reduced back into a long-term care facility is very unlikely, and give them greater comfort to know they wouldn't have to put those vulnerable citizens at risk again. So they're being careful and cautious, but they understand the personal anguish and the emotions and the concerns that family members have, and we would only like but to get that opened up as soon as possible. But the better we do it all, the overall scene, I think the sooner we could move in those directions. But we still have to do this in consultation with the Ministry of Long-Term Care.
Thanks, everyone.